Very good evening, everyone. Welcome to the webinar. We have our own faculty, Dr. Yogesh Kumar Singhal. So let's start with the webinar, sir. It's all up to you.
Thank you.
You're welcome.
Welcome all. Am I audible? Just post in the chat box. Okay, good, Abhijit and Muhammad Adil. So let's begin with the remaining portion. In last webinar, we discussed about the descriptive studies, and today we will do deep dive in analytical portion. I will try to complete as much as possible today. Okay, so what is happening here? In last time we have discussed about descriptive study, and today in analytical study, our objectives of the learning objectives will be to discuss the calculation portion that is very always troublesome for the students, and to understand the different biases in different studies, and to solve some MCQs that are high yield MCQs. Okay, so in last lecture it was the classification. I have shown you already in the last webinar that the epidemiological studies are classified into two parts, observational and experimental. So when there is a road rage or any accident, we can do two things only. Either we can observe from the side or we can participate in that. Okay. So here in observational, we have again two type of the studies, descriptive and analytical. So in last lecture, I described in detail about the descriptive studies. That descriptive study used to formulate or generate the hypothesis. Now, after we generate the hypothesis, we will test the hypothesis in analytical, and we will confirm that hypothesis in the experimental. So today we have this analytical portion, this portion. So in this portion, we will discuss about the how to test the hypothesis, or about all four types of the analytical study that are cross-sectional, ecological, case control, and the cohort study. Okay, so we are going further. So number one is, what is the analytical epidemiology? Already told you that analytical epidemiology is used to test the hypothesis. Okay, and we select the individual person to participate in that study. Suppose we are doing case control or we are doing cohort study. So we will select the individuals, suppose 50% or 100% or 200%. But the result is not for that individual. We will apply that result to the general population. This is how research works. Okay. We cannot do research on the whole population. We just do research on some sample, some part of the population only. Okay. And what is the aim of this analytical study will be, we have to identify the risk factor. We have to make a relationship between risk factor and the disease, that the risk factor is associated with disease or not. Okay. The second one, we have to determine the strength of association. Means if we established that there is a relation between the risk factor and the outcome, then how much is the strength of that risk factor and the disease? How much strength of association between both the factors and the outcome? So we try to find out the strength of association by using odds ratio in case control and relative risk in the cohort study. We will discuss it about it in later slides. So this is a sum up of the all type of analytical studies. There are four type of the analytical studies. Number one, ecological study. It is the basic study among all analytical. It may this is the basic first one, because it is done on the whole population. Ecological study is always done on the whole population, and in ecological study we always able to calculate the correlation coefficient. Okay, correlation coefficient. So this study is called as correlation study. And what is ecological study? Just I'm giving a brief here. That suppose it is a general statement that Indian people are obese. It is general statement. What will happen? The person who is not obese will say that it is false. The individual person will say it is false. This statement is not right for me. So there is the problem of individual fallacy in the ecological study. So in ecological studies are always talk for whole population in the general terms. Okay, suppose we can say Indians are obese, or we can say Indians are usually diabetics, or Indians are usually hypertensive. So these are the general statements which we can find out by the use of ecological study. So ecological study is always to be done for the population. And when we do ecological study, the disease exposure, it means the cause or risk factor and the outcome of the disease. Both things are present at the time of starting of the study. Okay. And it is neither backward, it is neither forward, it is just a cutoff point. Suppose today we try to find out that among 130 crore population of the India, what is the trend of eating rice. So we can say Indian people are fond of the rice eating. Okay, so it means the person who is not eating the rice will say that I am not a part of that study. It is called individual policy. Okay, understood. Now the next one is the cross-sectional study. So what is cross-sectional study? In cross-sectional, 1 minute. Yes. In cross-sectional, what we do, we just assume, or we just take a cross-section of a particular point. What is cross-section? Suppose this is a uh, object and we just make a cross-section like this. It means a cutoff point. Suppose cutoff point can be a point or can be a period. So for the suppose for today, assume that total number of cases of COVID in our city at this point at 6 p.m. of the 2nd May. So it will be considered as a cross section, and the total number of cases will called prevalence. So here cross sectional studies are useful to estimate the prevalence. This is why it is called the prevalence study. Okay, understood. Now exposure and outcome both are occurred in the cross sectional, and this study neither backward nor forward. The next one is case control and the cohort. So these both are the important one. And for theory examination, for UG examination, case control and difference between the case control and cohort is very important. And for NEET PG purpose also, odds ratio, attributable risk, calculation of the incidence or relative risk or population attributable risk, these four are very important for the MCQ point of view. So case control study is also known as case reference study. In this study, what we do, we take a case and we take control. The case, the person who is having disease, control the person who is not having the disease, and we will make the assumption by comparing both of them. Okay, and this is the backward looking study because the person is coming with us to us with the disease. So if a person is coming to us, is came to us with the disease, it means we cannot go forward, we will go backward. We will ask the person, suppose like history taking. So a person which is coming to us with the disease, it means what we will do, we will just ask, okay, whatever you eat, what you did, or everything about the past only. So that's why case control is called the retrospective study. But in cohort study is forward looking study, also known as follow-up study, because we will take the follow-up. And what is the meaning of the cohort? Cohort means a group. So we make a group of the people who are exposed to something. Suppose my age is 40 and I'm exposed to sugar eating. Okay, I used to take sugar. So eating sugar, I'm already exposed now. Uh, if I'm a part of a study, so my blood sugar level will be checked periodically to check that at what age diabetes will affect me. So it will be forward-looking study like this. Suppose we can take a person whose father is hypertensive. Now we will check the blood pressure of that person till the blood pressure develop at what age. So we have the person who is exposed, genetically exposed to the hypertension. So what we are doing, we know the exposed part. Now we will trying to find out the disease. So it may be lengthy. It may take years. It may take many years. Suppose in 2020-21, we all were exposed of the COVID vaccination. So we are a cohort, all of us who took the COVID vaccination shot. We all are the cohort of the COVID vaccination. Now, after 20 years, if someone try to find out association of particular disease with the COVID vaccination, the person who took the COVID vaccine 20 years ago, so we can be useful for them. Okay. So now there are some MCQs from this table, and your yeah, yes, attentive हो जाओ थोड़े से. The just tell me the answers here. Which of the following research methods studies have only people who are initially free of the disease of the interest? So in which of the following research method studies have only people who are initially free of disease of interest? Disease of interest means कि जो disease हमें study करना है. Okay. तो बताओ चैट बॉक्स में आंसर्स पोस्ट करो, क्या हो सकता है इसका आंसर. जे कोहट, केस कंट्रोल कोहट, चिदम्बरम सभी cohort. C. Rosie Paul saying prevalence. Sarita is saying cohort. Okay, good. Anyone? Case series तो नहीं है. Case control, Sayantani, beta, you need to study. You just need to check cohort. Okay, just read the question carefully. Which of the following research method studies? G2 is saying D, cohort. Studies have only people who are initially free of disease. It means जब रिसर्च में पार्टिसिपेट किया the when we entered the subject to the research was free of the disease, free from the disease. It means it cannot be the case control. Case control means the patient is coming to us with and that is we call the case. So case control cannot be a study when the people are initially free of the disease. Okay. Case series is just a case series. In case series, what we are doing, we are having one or two patients and we are doing a series on them. Prevalence study, prevalence is the word using for the disease. Prevalence, what is prevalence? Prevalence is total number of cases. So here we are talking about that the initially people are free from the disease. Okay. And in cohort, patient is coming to us or we are using the subject as a if exposure only, exposed only. We know about the exposed, but disease are yet to happen. Disease yet to happen. Okay. So we wait for the disease to happen in cohort study. So our answer will be cohort. It is a prospective study. So answer D is correct. The next one is all of the following have individuals as unit of study except. All of the following have individuals as unit of study except. I just told you in cohort study, we enroll the individuals in case control, we enroll the individuals in cross-sectional, we enroll the individuals and ecological studies. I told you, it is a correlation study, it is a population study, and we generally talk about the population, here only, that Indians are these, Africans are these. This is all are the ecological study. It is a very simple question. Now, they might ask this question like the analytical study where population is the unit of study is. So answer will be the same. Okay, the question might be framed like this. The analytical study where population is the unit of study, the answer will be the same. The answer will be ecological study. Okay, the next one is Cross-sectional studies. Cross-sectional study is, बताओ, cross-sectional study is a longitudinal study or a prospective study or a retrospective study or prevalence study. Cross-sectional, Croci Polish saying prospective, Saint Anthony prevalence, Asnich retro prevalence. Okay, I already told you there are four type of the study in the analytical, case control, cohort, ecological, and the cross-sectional. So case control is retrospective, cohort is the prospective. So prospective and retrospective both are excluded from the options. Now we have already only two option A and D, longitudinal and the prevalence. So longitudinal studies were running parallel like this. What is longitudinal? What is cross-sectional? The This is the longitudinal. Okay, this line is longitudinal. What is cross-section? This is cross-section. Okay, perpendicular. So longitudinal is retrospective can be longitudinal, prospective can be longitudinal, but okay, prevalence study. In prevalence, what we find out, we just find out the total number of cases at a particular point of time when we make a cross section. Okay, so answer will be prevalence study. And the next one is a person wants to study a disease X and fat consumption. He collected data for a number of people affected with X from the government hospital and details of fat consumption of the food industry. This type of study is known. A very good question. It is very important question. The option will be, what will be the answer? A person wants to study a disease X and fat consumption. He collected data for a number of people affected with X from the government hospital. So what he took the data of the people. Suppose he took a data of all government hospital of the India that 1 lakh people are affected from a disease. Okay. And due to this disease is due to fat consumption. Okay. And he collect the data of the food industry that total 1 lakh liter fat is sold. So how you do it? Okay. So yeah, just don't take tension. In experimental study, we do experiments. Here, you are not seeing any experiment here. We are not giving anything to anyone. We are not giving any medicine to any patient. So experimental cannot be the answer. Just exclude it. Now, ecological study. Ecological studies are population study. We talk about the general population, not about individual. So what he did, a person want to study a disease X, fat consumption, collected data of disease from the hospital. So he took the data of all population, the total number of disease in total number of cases of disease in the whole population, and detail of the fat consumption of the food industry, the total number of the fat consumption from the given population. So it can be a ecological study. In case control study, we have two groups. One is case group, one is control group. So here in question, they have not given that this is case group or this is control group. And in cross-section study, we try to find out the prevalence, the total number of disease. But from in this scenario, they have not mentioned any number. Okay. If and they have not even then also they have mentioned about the fat consumption. So this could be a ecological study. So answer will be ecological. Okay. Case control cannot be the answer anytime. In a UK study, it was found that there were more deaths from asthma than the sale of anti-asthma drugs. This is an example of question number 5. In a UK study, it was found that there were more deaths from asthma than the sale of anti-asthma drugs. Suppose what they are doing, they are just talking about randomly for the whole population. More death from asthma, more death from asthma in the whole population. Okay, in the whole population. Sale of anti-asthma drug for the whole population again. So they are talking about the population only. They are not talking about the individuals. They are not playing with the numbers. If they will give some numbers, it means that can be experimental or case control or cohort, anything. But they are just giving an assumption that there were more deaths from asthma than the sale of anti-asthma drug. It means it will be a ecological study. Yes, correct answer, Anthony. Then case control study is a type of descriptive, analytical, longitudinal, or experimental. Case control study is a type of, yes, analytical. Answer given by Anthony. 6B analytical, good. Because we are studying analytical studies, so the question is from the analytical. It's very simple. Okay. And descriptive we have already discussed in the last class, so descriptive cannot be the answer. Case control is not experimental. Okay. And it is a type of longitudinal study. So case control study is a longitudinal, but more or less cohort is the best answer for the longitudinal rather than the case control. And analytical, because they are saying case control study is type of. So type of analytical study. Analytical is obviously a correct answer. Then now we will discuss about, okay, I'm closing the chat box. Again, going to the case control study. So in this case control study outline, we will discuss that what is case control study, what are the basic steps of the case control study, like selection of cases. We will do the, first of all, we'll select the cases in the controls. Then we will do matching of the cases in the control. Then how to measure the exposure, what are the analysis, what are the biases, advantage, disadvantage, one by one we'll go. Okay. In case control study, if you are a clinician, if you are a doctor, and a patient is coming to us with the complaint of cancer, so you just come, the thing came to mind that is there any chemical exposure, or might be smoking, anything. So there is a real life example that in 1914 in New Orleans, there was a surgeon, Alton Oster, and that time in 1940, smoking was not established as a risk factor of the cancer. So that time the patient was coming with the lung cancer and were having history of the cigarette smoking. So that person was the first person, the Elton Ostner. He was the first person who tried to find out that that can be the risk. There might be a risk factor. Similarly, the same year in 1940, Australian ophthalmologist Norman Gregg, he see some cases of the infant cataract, and he find out that the mother who is a pregnant mother who has rubella, that their infant are having cataract. So he tried to establish the teratogenicity of the rubella. But there is a problem. We have case only. We do not have control. So that time, these studies were not considered as a case control. They were considered as a case series only. Okay. Now, what is happening in the case control study? It is a effect to cause study. The person is coming to us with the effect, and the study population, when is coming to us, is already had the exposure, already came with the outcome. So it means exposure and outcome both has been started before the starting of the study, and the study subject come with the effect of exposure. Obviously, patient is, that's why we are saying it is a case control study, because the person is coming to us is a case. And it is a look backward study, prospective study, because we try to find out the cause, or we try to find out the risk factor. It is simple. Suppose a person is coming to us with the with a complaint of diarrhea. And what we will ask, we'll ask that what you have eat what you have taken in the dinner or previous day or day before yesterday, what you have taken in the dinner or lunch. This is the question we'll ask. So what we are doing, try to we are trying to establish a relation of the disease and the risk factor. So this is how retrospective work. And we should take a control group which is comparable. Which is comparable means the age, sex, or occupation or socioeconomic status. These should be the same of the case group. So cases and control should be comparable. Like the suppose we cannot compare diabetics of old age, suppose type 2 diabetes with the children. Okay, we cannot compare hypertension of adult and in the hypertension the 10 to 20 year of the age, because in that case we will not find a single case of the hypertension. We cannot compare male and female, because suppose we cannot compare PCOD in female and the male, because there is no PCOD in the male. So you understood? Now the unit of study will be the individual. Individual factors will be considered, and it is done for the rare disease. Why for rare disease? Because for rare disease, the disease is rare. It is happening sometimes, and we know only that in rare disease, we don't know about the exposure history. So person is coming with a rare disease, and now we try to find out the exposure history. Okay, then this is the framework. We have two groups. One is case group and one is the control group. In case group, we have two type of the population. Case means who have the disease. Number one, who had history of exposure and who have no history of exposure. Suppose a person is coming to us with the complaint of lung cancer. Out of 100 lung cancer patient, we will ask the history of smoking. 90 will say that yes, we were smokers. But out of them, 10, 5, 2, 3, few will say that we never touched the cigarette. So they were the non-exposed. Okay. Similarly, we will take some controls who have exposure and non-exposed dono. It means we will take the person who is not a disease, who is not having a lung cancer, but he or she might having the history of smoking and no history of the smoking. Similarly, because sometimes many people say that we are not smokers, but we are not a smoker, but we developed the disease. Sometimes people say that we are a smoker, but we do not have any disease. Okay, understood. So there are two groups. Now, this is the framework case control study we create. We in this we take 1 minute. A minute. I am taking cursor. Okay, what we are doing, we are taking cases here in which disease is present. In cases, okay, suppose total cases are A plus C. So in A plus C, A are the person who is having positive history of the exposure. It means exposure is present. And C are these, these C. These are the population of cases who have no history of the exposure. Similarly, in the control group, B are not having any disease, but exposure history present. D are the person who do not have any disease and no history of the exposure. So there is some concordant group. Concordant group is this group, A plus B, exposure group and the non-exposure group. Concordant. Okay. And the discordant pair, in discordant, we are having a person who is a case with the exposure and a person who is controlled with the non-exposure. A plus D is the A plus D. Yes, this is A plus D is the discordant pair, and B and C are the discordant pair. Okay. This is not so much important. We can leave it. But for NEET PG, anything can be important because they are consumed with the questions. Na? Every year there are some new questions. Now, talking about the steps of case control study. So what we are doing, we are doing selection of the cases. We are selecting the controls. Now we will do matching. After that, we will measure the exposure. Now about the selection of the cases. So what we are doing, we have to give a case definition. And case definition, it should be specific, it should be valid, it should be reproducible. Reproducible means it should be repeatable or reliable. It means it should the case definition should be same throughout the study. And case definition should be operational. Operational means what is the means of operational? Operational means we assume that suppose I'm saying one statement, cigarette smoking causing lung cancer. We cannot do any estimation. But if I say 10 cigarette per day for 5 years will do lung cancer. So this is measurable. So our operational definition of case should be measurable. We should include the diagnostic criteria. We should include the staging criteria, eligibility criteria, and we should prefer the new cases over the older one, and we should also include some exclusion criteria. Okay, and case definition should be same. And from where we will take the cases, we can take the cases from the hospital or from the general population. Now about the selection of the control. So control must be free from the disease under study, and they must similar to the cases. Similar to the cases means they are from same geography. Say they should be same for demography, from the age group, for the uh, gender, for socioeconomic group, for occupation. Suppose we are saying that we are comparing diabetes cases among rich men, and control we have taken from the farmers. So it is not a comparison. Okay. A rich man is having high chances of developing diabetes rather than the farmer. So this will be the wrong. Okay. So control should be comparable to the cases. And number of the control should be depend upon the cases. Or control number are always greater than the cases. Okay. Agar if the number of cases are higher, we can take equal number of the cases in the control. If number of cases are less, we can take twice, thrice, or quarterly high. Matlab, means we can take in as much as control possible, but cases should always be lesser than the control. And if number of cases are higher, we can take equal number of the cases in the control. Okay, then selection of the control. So from where we will take the control? So we can take the control from the hospital patient. In same hospital, we take the patient of the some other disease, but the exposure should not contrary to each other. For suppose for MI, myocardial infarction, and for the bladder cancer, smoking is a common factor. Okay, and we can take relatives, we can take siblings, but for genetical study, siblings should be avoided because genetic, if a genetics is a reason for the development of a disease, so it will affect the study. Okay, neighborhood we can take, general population we can take. Now we will do matching. Why we will do matching? To remove the confounding factors. And what is confounding factor? It is very important. So confounding factor, when a risk factor is independently associated with the outcome and the exposure both. How is it possible? Okay, I'm just giving you an example. If a person is taking alcohol, okay, alcohol itself causing gastritis. You know, alcohol itself causing gastritis, and the person is eating chakna with the alcohol. In chakna, what is it eating? Taking some fritters, or taking some spicy namkeen, anything. Okay, and it may also cause the gastritis. So both things are individually can cause the gastritis. So here, daru chakna. In daru chakna, what is happening? Chakna is associated with the gastritis also, and it is associated with the alcohol also. Okay. So here, chakna will be our confounding factor. Understood? I think it is a good example for you. Okay. Suppose alcohol smoke and smoking for the esophageal cancer. There are some people who smoke along with the alcohol. When they drink, with they consume alcohol, they usually smoke. Okay, yeah. In some movies, I saw when a villain is smoking the cigarette and just doing like this ashes in the glass. Okay. So smoking and alcohol both are the causative agent, causative factor for the esophageal cancer. So here, if we will not nullify a single effect. Suppose either if we are doing a study in the smokers for the esophageal cancer, we have to exclude the alcoholics from that study. Otherwise, our result will be affected. Okay, and by we can do it by matching. We have to match each that the this thing is available in here or not, present or not. Then we will do some measurement of the exposure. And how to measure the exposure? We will take the interview from the cases, that the total number of exposure. You have to tell me how many cigarettes you are consuming per day, how many pegs you are taking per day or per week or per month. Okay. Then we can use self-administrator questionnaire. We will ask the case to fill the questionnaire. We will take the data from the hospital record. We will take the data from the employment record. We will do clinical examination on that patient, or we can do some lab investigation. And the method should be same for the case and the control. Then we will do the data analysis. Okay. And what we will do, we will do some we will find out the exposure rate among the cases and exposure rate among the control. After that, we will do the we will try to find out the strength of association between risk factor and the disease. Okay, how? By either exposure rate or risk estimation or the odds ratio. This is about the data analysis. This is an example. Okay, so here I have given some uh, okay, 1 minute. I have given some cases with the lung cancer and some controls with the without the lung cancer. Here, total 35 cases we have taken as with the lung cancer, and 82 controls we have taken without the lung cancer. Out of these 35 cases with lung cancer, we are having 33 smokers. It means they are exposed to the smoking. Out of these 35, we have two non-smokers. Okay. Similarly, in control group, out of 82, we have 55 smokers and 27 non-smoke. Okay. So we can, this is ABCD framework. This is A plus C total number of cases, B plus D total number of the control, A plus B total number of exposed group, and C plus D total number of the non-exposed group. Okay. Now, 1 minute. Uh, what we'll do? We will calculate the exposure rate. Exposure rate means exposed in the cases and exposed in the control. So here in 35 cases, 33 persons were exposed to smoking. So 33 upon 35 will be our exposure rate for the smoke for the disease for cases. What we'll do? We will do A upon A plus C. Here A is 33, A plus C is 35. So we will find out that 94.2% persons were smoker in the lung cancer. Okay. Similarly, in control group, 82 were the control who were not having any history of the lung cancer, but they were out of 82, 55 were the smokers. So what we will do? We will do 55 upon 82. So it means 67 smokers in the control group. Now, what we will do? We can use any test of association. We can use chi-square. We can use t-test to find out that value is less than 0.01 or less than 0.01, point zero 0.01 or less than 0.05. So our values will be significant or not. Okay, then here, how to estimate the risk? So we will calculate the relative risk. How a relative risk is to be calculated in the cohort study. Exact relative risk is to be calculated in the cohort study. But here, if we try to calculate the relative risk, how we will do? We had this thing. Okay. Relative risk, we can calculate incidence among exposed and incidence among the non-exposed. So here, incidence among the exposed is 33 by 88, and in non-exposed 2 by 29. Okay. 33 incidents among exposed. Total number of exposed group is 88. Out of them 88, we are having 33 cases. So 33 by 88 is the incidence among exposed. And in non-exposure, non-smoker, 2 cases out of 29. So 2 by 29 will be our incidence among the non-exposed. So we can calculate it by 33 by 88 divided by 2 by 29. So it is 5.44. But we are calculating here, but the exact relative risk we can calculate only, we can determine only in the cohort study. Now, the next one is odds ratio. Okay. So what is odds ratio? Odds ratio or cross product ratio, we are doing A into D divided by B into C. A into D, B into C. So we will do 33 into 27 divided by 55 into 2. The value will be 8.1. So if odds ratio is greater than 1, it means there is an association of exposure with the disease. It means there is a association of smoking with the lung cancer. Okay. So it is simple now. So you can calculate the odds ratio. Okay. Now, next is the potential errors in epidemiological studies. So what are the potential errors? Number one is the random error. Number two is the systemic error. Systematic error. Random error is called sampling error. Systematic errors are called bias. Okay. So random error is not bias. Random error is the sampling error. Systematic errors are the bias. So in random error, what is the error in the random error? It is sampling error. And in sampling error, we select the wrong case or we select the wrong control. So if we select the wrong case or we select the wrong control, then exposure and outcome will be different. And it can be done by reducing the it can be reduced by increasing sample size. So if we are having large sample, if we instead of 10 cases, 50 cases, 20 cases, we use 1,000 cases or 2,000 cases. In that case, the effect of one or two wrong selection of wrong cases will be nullified. Okay. Then the second is systematic error. It is also called the bias. And what is bias? Which produce different result from correct cases or the control. So cases are correct, control are the correct, but then other than this, there is some error, which is it is called bias. In random error, that was the sampling error. We were selecting the wrong case. In systematic error, we are not selecting the wrong case. Our case is correct, but there after that, even after that, there is some error. Okay, so these errors are occur during either data collection or compilation or analysis or interpretation. That's why it is called systematic error. And there are mainly three types of the bias. Okay, number one, bias due to confounding factor. Confounding factor, I already told you, if there is a factor which having association with the outcome and the disease both. Okay. Then next is the recall bias or memory bias. What is recall bias? Recall bias means cases are more likely to remember the exposure than the control. Okay, if a person is having disease and we will ask him that what is happening, you should tell us about your exposure history. So cases can tell us clearly about the exposure history, but controls cannot we or are less likely to tell us about the exposure history. The second thing, case might forgot about the exposure. Then second is selection bias. Selection bias means case or control may not be the sample of the population. There is a difference between the characteristics of cases in the control. It is called the selection bias. Then Bergsonian bias. Bergsonian bias is important. Many times it has been asked in the exam, and the question is coming just likely the different rate of the admission to hospital for people with a different disease. It means it is not possible that every day the same patient of same disease and with the same frequency are coming to the hospital. Okay, it is called the Bergsonian bias. Okay. Okay. Then interviewer bias. Interviewer bias means interviewer having knowledge about the cases. Interviewer know that this person is case, so he will devote more time with the case rather than the control. Now, how to reduce the interviewer bias? By using blinding. We should not tell to interviewer that he is case or he is control. Okay. The next one is Advantage of the case control studies. Case control studies are easy to conduct. There is no attrition. Attrition means loss to follow-up. So there is no follow-up. It means there is no attrition. These are the rapid and inexpensive in compared to the cohort, because in cohort we have to do follow-up. We are not doing follow-up here. We are meeting the patient 1 or 2 times. That's why it is inexpensive and rapid. And it is suited for the rarely or newly identified disease. Why? Because rare disease, we cannot estimate the exposure of the rare disease. That's why. Then it is suited for the disease which have long latency period. Because for cohort, suppose one disease having 5-year latency, 10-year latency, so we cannot wait for such follow-up. Okay. Then more than one risk factor are available for a disease. So if the risk factor are more than one, so case control will be better, because if we suppose for cohort study, we are taking control of a group of a single risk factor, and it is not leading to the disease in later life. That's why. Then minimal ethical problems, because we are not doing any experiment on the patient, and there is no risk to the subject. Okay. Then what are the disadvantages of case control studies? Study depend upon the subject memory. Obviously, that's why the recall bias is a problem. Finding an appropriate control may be difficult. Yes, selecting the suitable control is a difficult one. We can only establish an association between disease and the risk factor. We cannot say what comes first. This is also a thing that we can establish a association that this disease is associated with this risk factor. Okay, but we cannot clearly say that this disease comes with this risk factor. Okay, it can be say by the cohort and the experimental study. We cannot calculate incidence rate and relative risk, and it is not suitable for evaluation of the therapy or prophylaxis with disease. For this, we have to do RCT. Now, there are two type of the case control study, which is on the basis of cohort. So these are the cohort studies, but they are named with the case control study. Number one is the nested case control. Number second is the case cohort. So in nested case control, which is mainly predominantly a cohort study, what is doing here? A population is selected with the exposure. We are selecting a population with the exposure, and then as a case developed from the population, we take control from the same population, and we do case control. So initially, what we have taken, we have selected a population, and as a case developed from that population, we will take control from that same population. So it is a cohort study, but we are taking one case and one control. So it is a case control too. Okay, but predominantly it is a cohort study, nested case control. Second one is the case cohort study. So in case cohort study, we take a group, a particular group, okay, and from that particular group, we choose the randomly control. Similarly, it is similar with the population. Instead of population, we take a cohort, and we take from that cohort, when a disease develop, we select control from that cohort. Okay, then some example of some case control studies. Study of adenocarcinoma of the vagina, important one. Oral contraceptive and thromboembolic phenomena, thalidomide tragedy, and study of the Reye syndrome. These are the example of few important case control studies important for the NEET PG. Now some MCQs. Okay. Number one. Okay, ready? A study compared 150 children with a particular disease with 300 disease-free children to examine past experience that may contribute to the development of the illness. What kind of study is? A study compared 150 children with a particular disease. So what we do? We took 150 we took 150 children with a particular disease, and we took 300 disease free. Means one is case, one is control, obviously. So this is a case control study, and obviously we are studying case control. But in exam, you just think like this, that we have taken a case group, we have taken a control group. Answer is case control. Then next one is true about case control study is case control study is not possible for the rare disease. So we have discussed that case control is done for the rare disease. So A cannot be the answer. Odds ratio cannot be calculated. We can calculate the odds ratio. Okay, so A and B are the not the option. Third one, attributable risk cannot be calculated. Yes, it is correct. Attributable risk cannot be calculated. Yes, attributable risk we should calculate. We can calculate the attributable risk by cohort, and bias is not seen. Bias is seen in the case control. So option C is the answer of the exclusion. Our answer will be option C. Okay. Now for you, all of the following are advantages of the case control studies. Ready? Fast. All of the following are advantages of case control studies except one is saying option B, option A. The advantage except means wrong one. We have to select the wrong one. Sarita is saying that useful in the rare disease. Yes, we can use the case control in the rare disease, but we have to find out the except. So it is a advantage, but the question is asking the wrong one. Except. Santhani is saying option B. Relative risk can be calculated. No, not calculated. Yes, so we are asking for the wrong one. So answer will be B. Cost effective and inexpensive. Yes, case control are cost effective. So it is true. Odds ratio can be calculated. It is true. So option A is correct, B is wrong, C is correct, D is correct. So four advantages. There are three of them are the advantages. Useful in the rare disease, odds ratio can be calculated, and the cost effectivity. And relative risk is calculated in the cohort. So our answer will be B. Ritika is right. Okay. What is happening? Asnis. All of the following are the advantages, except one is the ask. Which of the following bias can be reduced by allowing equal interview time? It's a lame question. All of you should know the answer. The answer lies in the question. Which of the following bias can be reduced by allowing equal interview time? Option D, yes. Option D, yes. The answer lies in the question. Obviously, the problem is that interviewer, if biased, if interviewer know that this person is a case and this is control, control is free of disease. So he will spend more time with the case. And if we make sure that the time should be limited for the each person, either a case or control. So if we allow the equal time for case and for the control, we can reduce the interviewer bias. Or we can do blinding. We should not tell the interviewer that this person is the case or is control. But when person will take interview, he will know about that the person is having disease or not. So here blinding is little bit less possible. Answer is correct. Next, all can be used as controls in a study of genetic condition except. So if we are doing a study on a genetic condition, all can be used except hospital control, sibling control, neighborhood control, and the general population. So if we are doing a study on a genetic condition, and if we are taking hospital control siblings, we cannot take siblings in the genetic condition. You know why? Obviously, we cannot take the if we took the control. So we will not be able to do matching. Okay. So here is the problem. Hospital control, Deepika, no, what are you doing? All can be used as a control in study of the genetic condition except focus on the except one. we cannot take siblings for genetic condition study, because we know if the brother, two brothers or one brother sister or two sister, if they are having the same genes, they are having the same genes, then they should not to be compared for the same disease. Because if suppose if a if two sister having BRCA BRCA gene in one sister and another sister, both sister, so what we will not compare them for breast cancer, because there is a high chance that they both have the breast cancer. Hi Rajeshwaran, answer is sibling. The next question is important one. In an investigation to study the effect of smoking on renal cell cancer, it is observed that 30 of 50 patients were smokers as compared to 10 out of 50 control. The odds ratio of renal cancer associated with the smoking will be. Okay, just tell me the answer. Calculate fast. Calculate in the mind. We are having 30 cases out of 50. It means 20 are not cases, not exposed. Okay. It is observed 30 or 50 patients were smoker. Means out of total 50, 30 are exposed, 20 are not exposed. And out of 50 control, again 50, 10 are exposed, 40 are not. Now calculate AD by BC. तो बोला यार राइट, समझ में आ गया सबको, ये तो बहुत इजी है। 30 into 40, 1200 by 200, it is answer will be 6. Now it will be difficult for me to erase all this. Okay, correct. 6 is the correct answer. So which of the following is not a cause of bias? Which of the following is not a cause of bias? Ah, sorry. Sorry, my bad. You all know the answer. Okay, we have discussed that there are two types of the errors. One is the random error, the second is the systematic error. And systematic errors are called the bias. Random errors are not the bias. So here, confounding factors are the bias, selection bias is a bias, misclassification can cause the bias, but the random error are the sampling bias, sampling error. Sorry, random error is the sampling error, and the bias is called the systematic bias. So the random error cannot be bias. Random error is not a bias. Okay. So your answer is correct. D is the correct answer here. But it is this question is a confusing one. Okay. Confusing one. So just keep it in mind that random error and the systematic error, there are two types of the error. This random error is the sampling error, and the systematic error is called the bias. The next one is an odd ratio is equal to 1 indicates that the association between the two factor is perfect, low, high does not exist. Jab fast, tell me fast the answer. D does not exist, does not exist. Okay. Odds ratio 1, answer is D. Yes, correct. Correct, correct, correct. Okay. Odds ratio should be greater than 1 for any association between the exposure and the case. So answer D is correct answer. The next one is Bergsonian bias is a selection bias, interviewer bias, reformation bias, or the recall bias. Now, अब बताओ, just tell me. It is tough one, बहुत tough है ये. इंफॉर्मेशन बायस। और कोई कुछ? सबने अलग अलग बता दिया। वन इज सेइंग सिलेक्शन, वन इज सेइंग इंटरव्यूअर, वन इज सेइंग इंफॉर्मेशन, वन इज रिमेनिंग विद द रिकॉल। तो रिकॉल बायस वाले भी आ जाओ भाई, कोई रिकॉल बायस भी बता दो मुझे। Ritika is saying selection bias. Okay, so Bergsonian bias is a hospital. It is based on the different admission rate on different days in a hospital. So when there, because hospital Bergsonian bias says it is difficult to select the cases. Why? Because the cases on different days are different. We want cases of the hypertension, but today there was not even a single case of the hypertension in OPD. So how do we will select? So there is a problem of the selection when we are having Bergsonian bias. Okay. After enrolling in the study, interviewer will come. After enrolling in the study, information bias will come. Okay. Because after enrolling in the study, recall bias will come. But to enroll in the study, we should have the patient, and we are not having patient today because today not even a single case of the COVID came to the hospital. So it is called the Bucksonian bias. Okay. So answer will be A. The next one is the false about the odds ratio. False about the odds ratio. It is always positive. It can be 0.3. It can be 3.0, or it is always greater than 1. Sampling is saying Rosnich is saying D. Saintony A. False पूछा है Saintony. Akshuna Kirti saying D. Sarita is A. They are asking odds ratio is always positive. How can it be negative? Okay, बेटा बताना मुझे. How can it be negative? We are doing AD by BC. We are having number of exposure. We are having number of the cases. So the exposure cannot be negative. Numbers cannot be negative. So it cannot be negative. So it is always positive. It is true. We are asking about the false. It can be anything, any value. And the option is saying it is always one greater than one. How? We are taking, if suppose I am studying uh, any disease with the which is not associated, exposure is not associated with the disease. In that case, odds ratio will be one, or it can be less than one. And now you just understood here, and one option is 0.3 and one option is greater than 1. Option B is saying it can be 0.3. Option D is saying it is always greater than 1. It means option B, either option B will wrong or option D is wrong. Okay. In in this case, A and C cannot be the answer. Either B is the answer or D is the answer. But we know that it cannot be always greater than one. And this is a thumb rule. You just keep it. Just remember it. In MCQs, when there is option is saying always, you just it should be click in your mind always. मेडिकल में कभी कुछ ऑलवेज होता है क्या? आज तक ऑलवेज 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 तो कभी नहीं होता भैया, दुनिया में कुछ भी नहीं होता. नथिंग इज परमानेंट इन दिस वर्ल्ड. तो ऑलवेज कैन नॉट, इट इज वेरी रेयर दैट ऑलवेज इज अ ट्रू वन. ऑलवेज ऑलवेज फॉल्स ही होता है. ओके. सो डी इज द करेक्ट आंसर नाउ. डी इज द आंसर हियर. सो केस, तो हमने आज केस कंट्रोल ही पूरा किया है. वी वर एबल टू फिनिश केस कंट्रोल ऑलरेडी, and it is almost 1 hour, an hour. So for cohort, we should have next session, or should I do it today? Just reply fast because it will take around 30-40 minutes. That's why. Should I do it today or we should have another session? Next, sir. Very good. मैं भी यही चाहता हूँ ना. अभी ड्रीम 11 पे टीम भी तो बनानी है. 7 बज गए. 7:30 से मैच है ना आईपीएल का. ड्रीम 11 पे टीम बनानी पड़ेगी ना. नेक्स्ट नेक्स्ट नेक्स्ट. गुड. ओके. So there will be a next time. So I am handing over the webinar to Miss Radhika. Ms. Radhika, are you here?
Yes, I am here.
Yes. Okay. Yes.
Yes,
So
thank you so much,
I,
sir.
wa- I was not able to complete the webinar today. It
Okay,
was lengthy, little bit lengthy, and I was slow also. So now we will have another session.
sure, sure.
I'm handing over podium to you.
Okay, thank you so much, sir. It was really an interactive session, and we find that our audience is also very active today.
Ah, yeah, yes, yes.
So, guys, right. So, I won't be taking much time of your. So, sir, can you please stop the sharing?
Yes, obviously.
Okay. So as we have a DigiNeat as our course, I would like to convey all the information related to it. Simplify your undergraduate studies and NEET PG preparation with comprehensive program covering all 19 subjects crafted by India's top faculty. It includes video lecture, printed notes, OSCEs, question banks, test series, and the innovative Dr. Wise AI chatbot. So the faculties that we are having our Dr. Achut George Pharmacology, Dr. Sri Ram Bhatt, our very own faculty, Dr. Yogesh Singhal for community medicine, Dr. Madhu Chaudhary for pathology, and then we have Dr. Roshni for gynae, Dr. Vivek Pandey for orthopedics. And the offerings that we are having as a course feature are 1,490 plus hours video lectures, 1,500 plus topics in notes, 12,000 plus question banks in questions in the question bank, 2,800 gems that we are having, and then 140 plus OSCEs, test series, Dr. Wise AI chatbot, drug chart, regular webinars, and also we have printed notes. So this is just a glimpse of the videos that we are going to have further in the course. Then the offerings for the prices we are having is for 12 months, we are having 15,999. Hello.
So audible.
Okay. So just a second, where it is. Yeah. So for 12 months, we have 15,999 rupees. Then we have for 24 months, we have 20,999. Then for 36 months, we have 25,999. For 48 months, we have 29,999. For 60 months, we are having 31,999. So then we have a 10% additional discount, which contains the coupon code WBPSM. And also the offer is valid till 5th of May for this month. And then we have a 3 days money back guarantee. Again, we have printed notes which are available on an additional cost. The amount is 8,999 only. So this is all we have for the DigiNav, and also we have the contact number, which is 8800418418, and the marketing email where you can share concerns with us, which is marketing@diginav.com. Thank you so much, guys. Let's connect again for the further webinar. Thank you.